So medications do help with the fever, and most of the mechanisms act on the central thermostat by reducing the perception of need to increase the heat. So paracetamol is one of the commonest and safest options to treat fever. It's often used as a first-line medication, and it is well tolerated. It acts by altering the response of the body control system causing the fever. High dosing and repeated dose can cause liver toxicity. One of the important things we should remember if there are adults who take paracetamol regularly is to use child-proof lock for the paracetamol tablets, because sometimes we come across paracetamol poisoning from the child taking 1 or 2 tablets even of paracetamol. For adults, of course, you need 8 to 10 tablets to cause a significant problem, but paracetamol poisoning is one of the common poisonings we see in the emergency, so keep your medicines locked away. For parents, you usually have the dose that your pediatrician has recommended. However, it is good to know if you have a doubt to double check. So 10 to 15 milligram per kilogram body weight per dose. Most of the pediatricians give closer to 15 milligram per kilogram body weight per dose, as the safety margin is quite good. For paracetamol, we don't usually see side effects. So you can look at 10 to 15 milligram per kilogram per dose, and the repeat dose is to be given 6 hourly as far as you can. Earliest you can repeat it is 4 hourly, but you shouldn't give more than 4 doses in 24 hours for the above reasons. If you do have the preparation, you need to know exactly how much is there. If it is a drops, we speak of milligram per ml. So the most commonly available drops like Adol have 100 milligram per ml, and your dosage will depend on that. For example, in a 10 kilo child, if you give 15 milligram per kilogram, you can give 1.5 ml per dose. And in syrups, usually we have two strengths, the infant strength and the child strength. Infant strength is up to 6 years of age, or for heavier kids, you can change over by 4 years of age. And it is 120 to 125 milligram per 5 ml. There are also preparations which have 160 milligram for 5 ml. So please read the label carefully depending on what you have, and you can stick to one preparation because the child is used to the taste. And older kids, paracetamol usually has 250 milligram per 5 ml. So again, don't mix up. If you have two kids of different ages, be clear about which medicine is for which kid. If you want to stick with the same medicine, you may have to give a lower dose for the smaller baby if you're using the older kids paracetamol. Of course, the taste is different, and the one for younger kids is usually more tasty. In young infants, follow the physician advice, and if the baby is under 3 months of age, if there is a fever, do not self